Welcome, everyone. Good afternoon. We're going to get started now. My name is Colin Bader, and I will be your host for today's event. Pandemic Reflections, Protecting Public Health from COVID to Climate Change, in which 3 UNE experts will discuss what we can learn from the pandemic to strengthen our preparedness for climate change. I'm an assistant clinical professor here at UNE in the Health, Wellness, and Occupational Studies program. And I am also a member of the UNE Planetary Health Council, the group who is bringing you today's event. Since 2017, UNE has been an institutional member of the International Planetary Health Alliance, a Harvard-led consortium of more than 240 universities, non-governmental organizations, and other institutions spanning more than 40 countries. At UNE, our Planetary Health Council is working hard to strengthen bridges between our environmental sciences and health professions programs, and to provide planetary health content through academics, research, and events like this one. Today's event is brought to you through a partnership between the Planetary Health Council and the Center for Excellence in Collaborative Education. This event is the 5th of a 6-part series exploring the broad impacts of COVID-19 and spanning themes of aging and isolation, emotional resiliency, social determinants of health, and climate change. Today's event will address interprofessional competencies of values and ethics and teams and teamwork, and can be applied toward UNE students' interprofessional honors distinction badge. Today's program will begin first with introductions from today's speakers. Then the panelists will give their presentations on this important topic. And we are then allocating ample time for audience participation and discussion with all of you, as well as our closing remarks. I will now invite our student discussion moderator to introduce herself, Camden Tillinghast.
Hi, everybody. Thank you so much for having me today. My name is Camden Tillinghast. I am a senior studying health, wellness, and occupational studies here at UNE, and I'm going to be the discussion moderator for today. So I invite our audience to pose your questions and comments in the chat function, and I'll be checking in on those. And then it would be great if you could also include your major, program, department, or profession when you post your question. So I will now hand it off to our first panelist to introduce herself, Dr. Meghan May.
Hi, everyone. Thank you for inviting me, Colin, and the introduction, Camden. My name is Meghan May. I'm a professor of microbiology and infectious disease in the Department of Biomedical Sciences at COM. My research and expertise is in emerging infectious diseases and of late, COVID-19. So with that, I'll hand it to Dr. Holly Parker. Oh, I'm sorry, Dr. Jen Gunderman. I apologize. I had the order wrong.
Thank you, Dr. May. And while I appreciate the subject matter expert title of doctor, I'm not one yet. I'm currently pursuing a doctorate in public health at the University of South Florida, but I'm trained as an epidemiologist. I've spent most of my professional career working in state government, with global health organizations, and now in academia. I've been with the University of New England for about 6 years now, kind of circling many different programs, but landing today with the Area Health Education Center, otherwise known as AHEC, and assistant clinical professor. And now I will hand it over to Dr. Parker.
Thanks, Jen. Hi, everyone. My name is Holly Parker. I am the Associate Provost for Strategic Initiatives at the university, as well as the Director of UNE North, the Institute for North Atlantic Studies. My research is in the area of public policy, and specifically in the area of sustainable development leadership and how we lead towards sustainable development initiatives. So I'm excited to be here today, and I will hand it back off to Camden and Colin.
Thank you, everyone. Thank you to all our panelists. We have a truly remarkable group of experts gathered here today. I'm now going to hand it actually back over to Dr. May, our first panelist, and she will share her expertise on the science of pandemics and lessons for the healthcare system that will help us better prepare for climate change?
Great. Thank you, Colin. I'm just going to share my screen quickly. And as per usual, I have 700 tabs open. So I'm going to give a quick view about the pandemic through the lens of biomedical sciences. And before I do the science of an emerging disease that spreads to pandemic proportions, I'm going to start with a quick story. And the comm students who are on here, bear with me, as I believe you've heard pieces of this before. So my story begins on December 30th, 2019. That is me. Those are my boys. That is an ice sculpture celebrating the new year, which turned out to be fabulous so far. That is the Marriott Long Wharf, and that is us returning from dinner at roughly 10 p.m. under a streetlight, so it looks like daytime, but it was nighttime. After this picture, we all went inside. We got everybody bathed, snuggled, storied, put to bed, and then husband and I looking at phones for a few minutes. And at that moment, I made the silly mistake of saying, hey, before I go to sleep, I'm just check my email real quick. You just don't do that ever, because it's never quick when you check your email at midnight, because that's when exciting things happen. And at this particular day, on the stroke of midnight, this alert was issued through an early outbreak response portal called ProMed. What this alert said was that there were reports of an undiagnosed pneumonia in Hubei province, and this was a request for information. One thing about this, before I show you some of what was in this very prescient alert, was that it was a machine translation from an article originally written in Mandarin. And I point that out because, as some of you may or may not have experienced, Mandarin and English don't always directly translate. And that's important. And Professor Gunderman is going to talk about this a little bit more, because in the early days of a crisis, it's very important to have clear communication. And when you're trying to read tea leaves with an inexact translation, that can get a little bit dicey. And just for funsies, I have to put this picture up too. This is a picture my husband took in Tianjin, China, several years ago. Now we can look at this and tell it's a sign that says parking lot, but what it literally says is the station wagon parks the area, which is not parking lot, but you can kind of get the point. So there were a lot of little nuances like that in these early alerts because they were all machine translated. Okay. So what this alert actually said was that we had an undiagnosed pneumonia in Wuhan, Hubei province. Here are some important pieces. A pneumonia of unknown cause on a red-headed document, government red letter, and that this was being circulated because reading between the lines, a healthcare worker leaked the document to a reporter who then published a story about it, and that's when the world became aware of it. There were elements that suggested that we were dealing with a zoonotic spillover event. More on that in a second, because several of these early cases had been visiting an open-air market in a very densely populated city where there's on-site butchering and often on-site mixed livestock. And the final piece that was important here was that this new disease was causing something called acute respiratory distress syndrome, which is an incredibly severe pneumonia that is often life-threatening. And when I read all of those things at midnight on December 31st, that's what my face looked like. I mean, I assume that's not actually a picture of that moment. That's me in my kitchen eating something spicy, but I'm pretty sure that's what it looked like. Anyway, after 2 more ProMed alerts, we start to get more and more concerned. And on January 1st, I wrote the following little post. I'm just going to point out the highlights here. The first was that there are some very eerie parallels to the SARS epidemic of 2003. Boy, that one was on the nose, wasn't it? So here are the minor points I made in a nutshell. That the description of the chest X-ray and the fact that antibiotics didn't seem to help anybody, that almost certainly said that this was a primary viral pneumonia. And as it turns out, those are actually pretty unusual. There are only a few viruses that'll do it. And then I talked about why I didn't think it was any of the ones we already knew. And then I landed here saying, taken together, I think this is a new thing. And it's consistent with another novel coronavirus. How about that? And then at the bottom here, I said, what can be done about it, or if anything needs to be done remains to be seen. And of course, that's adorable in hindsight. Okay, so where do zoonotic spillovers come from? Mostly they come from animals, hence the name zoonotic. We all have microbes that live on us and in us and keep us safe, keep us healthy. We have microbes that have co-evolved to make us a little bit sick, enough to facilitate their transmission, but not necessarily kill us. But the microbes that are good and healthy for me may be detrimental to my dog. The microbes that are good and healthy for my dog may be lethal to my goldfish, right? Because these are things that are landing in a habitat that they're not accustomed to. And sometimes they behave erratically. Just to kind of orient you to a zoonotic infection that you may already have heard of, just want to give this quick schematic of the bubonic plague. Hopefully we've all are familiar with that disease to some extent, but what we may not know about it is that it is a primary zoonotic disease. The microbe that causes plague lives quite peacefully in mice, rats, voles, that kind of thing. If it gets into slightly bigger small mammals, prairie dogs, cats, squirrels, that kind of thing, they can actually get quite sick. And if they come in contact with humans, or fleas that are biting them start biting humans, humans can get extraordinarily sick. So why do these things happen? And why do they seem to be happening with more frequency? So they happen for a lot of reasons, but the primary driver here is that you have contact between human and animals, or animal to human, in sort of a complex web. So why that happens more and more frequently are things like habitat encroachment, right? Humans live where humans didn't used to live, and humans have altered habitats in ways that have caused interactions between animals that didn't used to happen. This is an image from Malaysia, where you can see here you have a pig in an open pen. It's living under a tree, which is a date palm, which is infested with bats. You've got some birds over here. You've got wild birds, and you've got a farmer and a vet walking around taking care of them. So you have a lot of interactions there that can cause microbes to go from one place to another. We also, as we're driving climate change, we're also changing things like migration patterns, not only of people, but also of birds. So you have species of birds crossing migratory paths that may not have previously interacted with each other, and they can then exchange microbes and then go back and pass them to other humans. The same thing is happening with arthropod vectors. So ticks, mosquitoes. This is an image of something called kissing bugs, which did not used to be in the United States, but now are in the Southwest and in Florida as well. And these can spread diseases, and they can facilitate disease outbreaks that may not have been previously possible. And then finally, we've, in the recent decades, really changed our animal husbandry and butchering practices, so that we tend to have high densities of animals packed very, very close together and in physically stressful conditions. And that can be an absolute heyday for spreading of microbes. And then finally, we shouldn't discount just bad luck, where you have the right bat and the right pig and the right person all coming together to create an exchange of microbes that didn't previously happen. Okay, so the last thing I want to say, because I forgot to set my timer and I hope I haven't talked too long, is how does this happen exactly? So this is my favorite analogy about how diseases adapt to a host, pegs and holes. Every infectious agent has a ligand on it or an adhesion on it that's going to allow it to stick to a host cell and infect it. And you have to have a very specific interaction between those two things. You have to have the right peg and the right hole, otherwise you're not going to get a productive interaction. So what does that mean exactly? Most of the time, if you have somebody landing in a place where they didn't expect to be, so a microbe landing in a host that it didn't expect to be in, most of the time nothing happens because you have a square peg trying to get in a round hole, it doesn't work. You have Ariel, who has suddenly become human, underwater, way out of her element, and without the assist from Flounder and Sebastian, she would have been dead. So 99.99999% of the time, this is what happens, right? We get a microbe landing outside its habitat. It doesn't survive there. It's not happy there. It's gone. Every once in a great while, though, you get a Dorothy, right? And so what happens with Dorothy is that she lands in Oz, totally out of her element, just like Ariel, but just by trying to get back where she wants to be and just kind of making it work for her, she winds up taking out the entire power structure of the land of Oz. And so in this scenario, SARS-CoV-2 is Dorothy, right? Every other thing that my dog sneezes on me that doesn't get me sick is Ariel. But right now we're dealing with Dorothy. So with that, I would like to hand it back to Colin for the next talk.
Thank you so much, Dr. May, for sharing your expertise as well as that compelling story regarding the start of the pandemic. I'm now going to hand it back over to Professor Jen Gunderman, who will examine the pandemic's lessons for climate change from a public health emergency preparedness perspective.
Well, I just want to first propose another webinar someday, and it's watching the movie Outbreak with Dr. May. Because if she can bring Mermaid and Wizard of Oz to life in a public health pandemic way, I can only imagine the critique of Outbreak with Kate Winslet. So I will be there for that one. So thank you again for having me here today. So I've been a public health practitioner for just about 25 years now. And my presentation is going to focus on the lessons that I've learned and maybe a few wise words of wisdom based on my sort of mid-career experiences. So next slide. So I'm going to give you my top 5 lessons that I have learned so far from the COVID-19 pandemic. I could give you a list of 100 today and probably a new set of 100 tomorrow, but I'm going to focus on sort of those top 5. And the first one is that a pandemic can happen. And not just a pandemic can happen, it can happen in a very devastating way. Now, let's think back to 1917, which is the year before the pandemic flu of 1918. And the life expectancy was about 50 years old, all races, all genders, all ethnicities. And we can somewhat imagine around 1918, the conditions that contributed to the pandemic at that time. There was incredible crowding, there was poor sanitation, and really limited healthcare. Now, fast forward to 2020, and today our life expectancy is about 78 years old for the country. Again, both all genders, all races, and ethnicities. And despite environmental conditions being much different than 1918, incredible improvements in technology and advances in healthcare and public health, we are dealing with a pandemic of devastating proportions. So this pandemic is real and it is devastating. So Make no mistake, when we talk about climate change and the devastating effects that it can have, we are experiencing it, and we will experience it unless significant changes are made. Next slide. I promise it's going to end on a good note. Starts devastating, ends optimistic. So lesson number 2 is around just knowing what public health is. So until I was about a junior in college and I changed my major, I had no idea what public health was. And until I went to my first day on the job at the state health department and was asked to investigate an outbreak of pertussis, I had no idea what epidemiology was. And up until about 7 months ago, I still had family and friends asking me to look at a suspicious mole, thinking that I might be a dermatologist. But things have changed in the past 7 months, and public health has become a part of our dialogue. News, articles, we are reading about public health. We are seeing public health before our eyes and the important role it has in protecting health and promoting well-being. And you'll often hear, like the latest epidemiologist said, that is actually becoming part of our dialogue. And so as we think about climate change and public health being part of the table, we can really look to some of the infrastructure frameworks and the practices that we've used in public health for so long and apply that to a climate change response. Next slide. So lesson number 3 is around health disparities. And health disparities is not new to public health. For decades, we have been analyzing the data, reporting the data that shows that some populations are disproportionately affected by health issues. We have seen this around infant and maternal mortality, diabetes, and many other health conditions. So it was no surprise when we saw health disparities related to COVID-19. However, it is in our life right now. It is in our presence, and the inequity is costing people their lives. So in this slide, I share a couple of concepts. One is from the graph is from a Harvard University working paper, where it clearly shows the data that people living in poverty and/or crowded situations and/or populations of color have highest rates of COVID-19 in the United States. In the other, I show a snapshot of an article, a study done around a concept called weathering. And you can see in the study's conclusion that even when poverty is adjusted for, Black Americans are disproportionately at a higher risk for health complications, primarily due to the effects of discrimination, both implicit and explicit. This is no different with climate change. Climate change disproportionately affects various populations, and the idea that weathering not only happens to our planet, but it happens to humans, and particularly those who are vulnerable to health disparities. Next slide. So the next lesson has actually been a really new lesson for me, and it's been around this concept called infodemic. So infodemic is a concept that was coined by a journalist, David Rothop, in an opinion piece he wrote for the Washington Post back in 2003 to describe the outbreak of misinformation related to SARS. Now, this article was published in 2003 about the spread of misinformation. This is a year before Facebook was born. It is WhatsApp was born in 2009 and Instagram was born around 2010. So this was even before the spread of social media. And he described infodemic as a few facts mixed with fear, speculation, and rumor, amplified and relayed swiftly worldwide by modern information technologies. And again, that modern information technologies reference was even before much of our social media sort of came on the scene. Now, this chart shows us, it's a study done by Harvard, Northeastern, Northwestern, and Rutgers University. It's a survey around misconceptions. And what we can see, just for one example, is over half of Americans either believe or somewhat might be unsure about the statement that coronavirus was created as a weapon in a Chinese lab. And as the WHO director states, we're not just battling the virus, we're also battling the trolls and conspiracy theorists that push misinformation and undermine the outbreak response. Climate change is also impacted by infodemic. Next slide. So Stop the Spread has actually been a campaign in England. It's not just about the stop the spread of the virus, but stop the spread of misinformation. And infodemic has actually now become its own science with epidemiologists, and the World Health Organization actually sponsored the first infodemic conference this year. The World Health Organization has a page on reporting misinformation and addressing myths. We are wasting precious time, energy, and resources dealing with misinformation. It's important, but this is time that we could be spent doing so many other important things. This is clearly a lesson that can be learned around climate change. And last slide. So we can save the world, and we can save the world together. And how do I know this? As a globe, we eradicated smallpox. As a Western Hemisphere, we have eliminated polio with the last reported case in 1991 in Peru. The UNE community has not had a known case of COVID-19 on campus since September 19th. This is what happens when people listen to science and care about each other. This is what happens when, as Margaret Mead put it, never doubt that a small group of thoughtful, committed citizens can change the world. This is more than a quote to use as a tagline on your email, but really a call to action to control this pandemic and to stop climate change. So thank you for allowing me to share my lessons learned. I'm now going to turn it over to Dr. Holly Parker.
Thanks so much.
Okay. Two tough acts to follow. Thank you, Professor Gunderman and Dr. May. So I want to have my comments take a look at how both COVID-19 and climate change have revealed the inequities in our systems that Professor Gunderman talked about, and also talk about how we might change our framework for thinking and how we develop solutions to those challenges. So as Professor Gunderman mentioned, COVID-19 has had a disproportionate impact on in the US by race. And Maine ranks, unfortunately, worst in this category. At one point during the pandemic, 25% of cases in Maine affected Black Mainers, who make up less than 2% of the population. That number now stands at 17.5%. The state is looking into why this disparity has occurred, but public health experts hypothesize a link between infection rate, income, and density of housing. Nancy Krieger at the Harvard School of Public Health lists several factors that have put Black, Indigenous, and people of color at greater risk for COVID. They are more likely to live in crowded situations, to work in service jobs that put them in close proximity to others, to have to go to work because they can't afford to miss it, to take public transportation, and to lack access to protective gear. They're also more likely to have pre-existing health conditions that increase the risk for COVID and to lack access to healthcare and health insurance. Systemic inequities, though, are also highlighted in the secondary impacts of COVID-19. The working poor have faced a two-sided challenge. Many are deemed essential workers and are required to report to work at low-paying jobs in public-facing service roles, potentially exposing them to the virus while many of us were in lockdown. Those deemed non-essential were those most likely to be laid off during the economic downturn. Fed Chair Jerome Powell just last week acknowledged that, quote, the burdens of the downturn have not been evenly shared. The initial job losses fell heavier on lower wage workers in service industries facing the public, job categories in which minorities and women are overrepresented, end quote. Many of us are also aware of the inequities in broadband access in rural Maine. This systemic inequity has reduced access for rural Mainers to telehealth and education. Kids are unable to learn remotely, and folks are unable to access healthcare, both physical healthcare and mental healthcare services. Here in Portland, the pandemic has forced services for those without homes to adapt. One example is the closure of day shelters, such as the Preble Street shelter. In addition, for those services for those coping with addiction have been limited by the pandemic. the most needy among us have been the least able to effectively adapt to the pandemic, exacerbating those existing inequities. Next slide. Climate change plays a similar role in revealing inequities in our existing systems. A key element of climate change, the increasing number and intensity of storm activity, disproportionately impacts those who are low income or without homes as they face increased displacement and loss of property. More than 3 years ago, Hurricane Maria hit Puerto Rico. The island is still recovering. Homes need to be repaired, water systems rebuilt, schools and hospitals remain closed, and the island's economy has been badly disrupted. But throughout Puerto Rico, the poorest communities were the hardest hit and are furthest away from recovery. While many wealthy folks were able to rebuild or to leave the island, poor families have had to wait months or years to get relief. And just as climate change deepens inequalities within a country, it also further stratifies international relations because some nations are more threatened by climate change and others have fewer resources to deal with the problem. Christina Chan, the director of the World Resource Institute's Climate Resilience Practice, says, quote, the world's poorest communities often live on the most fragile land, and they are often politically, socially, and economically marginalized, making them especially vulnerable to the impacts of climate change. More frequent and intense storms, flooding, drought, and changes in rainfall patterns are already impacting these communities. Climate change here in Maine also has a disproportionate impact on those communities that rely on subsistence hunting and farming. For example, Maine tribes that rely on moose as a food source are deeply impacted by the recent increase in tick populations that are actually killing moose. Moose are being found with thousands of ticks embedded in them. Changes in sea level, acidification, and the warming of the Gulf of Maine are impacting the health of key marine species for our tribal communities. Next slide, please. So the UN has warned that climate change is the major threat to global security. I would argue that pandemics like COVID-19 pose a similar threat. We've seen that both phenomenon have the ability to impact food systems, both the foods we get at the supermarket, but also the food we take from our immediate environment. We see they both have the ability to disproportionately impact those who are already suffering from poverty. This week, the World Bank estimated that an additional 88 to 115 million people could be pushed into extreme poverty in 2020 because of the pandemic. That's living on $1.90 a day. They estimate that number could reach 150 million in 2021. According to the Internal Displacement Monitoring Center, there were 18.8 million new climate change disaster-related displacements in 2017. Most disaster displacement ends up working within countries, so people do not end up leaving their nations, but displacement across borders also occurs and is often interrelated with violence and conflict. When populations are displaced and their ability to acquire basic fundamental needs for survival, migration and conflict are often the impacts. The UN refers to this phenomenon as climate refugees. I would argue that we could see a trend of pandemic refugees if this pandemic persists. So what do we do? That is a lot of heavy, heavy news. I was on a call last week with some colleagues in Scotland, and we began imagining what COVID relief could look like. Next slide, please, sorry. COVID relief could look like if we applied sustainable development and adaptive resilience theories to our thinking. Could this be a moment where we use this massive disruption to our systems to address the existential challenges both of pandemic and climate change, but also the inequities that have girded our systems for many years? Sustainable development and its foundational belief in the interconnectivity of human and natural systems is a framework by which we can simultaneously consider the health of communities, economies, and environments. In this framework, we consider not only the cost and benefit to a system of an action to a particular system, but to also all systems with which it interconnects. However, this framework has not been used the norm in developing systems that we live in and with today. The concept of adaptive resilience dovetails with sustainable development. It states that in responding to disruptions like COVID-19 or climate change, no human system is beyond questioning. If we only build solutions that fit the systems that exist, we can make incremental progress, perhaps relieving a symptom. but we may not address the underlying inequities inherent in that system. So we must hold no cows sacred as we consider next steps and navigate new paths forward to true resiliency. If we return to business or systems as usual, we will miss an amazing opportunity to leverage this moment of disruption for real transformative change. So with that, those are my comments, and I look forward to a great conversation.
Thank you so much to Dr. Parker, Professor Gunderman, to Dr. May, for sharing that wide breadth of knowledge, expertise, compelling lessons, stories on these extremely critical and urgent issues. So we're now going to move on to the next part of today's event. We're going to encourage questions, comments, thoughts, stories from you guys in the audience. So for viewers on Zoom or Facebook Live, please take some time right now to type your questions, your reactions, your ideas using the chat function. We really want to hear your perspectives on these issues as current and future leaders in the health professions and environmental sciences, and also as engaged citizens of our community and world. As you start typing in your questions and comments, our student co-host, Camden Tillinghast, will moderate the discussion.
All right, so we already had a question come in from Facebook from the UNE Center for Excellence in Collaborative Education, and they were wondering if the panelists could share a story of when a public health intervention has been successful in the context of climate change.
I can start that one off. So first I'll say, as an epidemiologist, the fact that we are collecting data to be able to make decisions around climate change and human health and animal health is already a public health accomplishment. When we collect and analyze and interpret and disseminate data in silos, that doesn't help anyone to understand how we're going to move forward. So from an epidemiologist standpoint, just collecting data and looking at it within the lens of how all these connections happen is a success. But I will just take just 2 minutes to explain, I think, maybe one global success story related to climate change. So my sort of favorite disease is called guinea worm. And guinea worm happens in another part of the world where a person actually has a worm grow inside of their body, and then it's released through a blister, and then it enters water source. The people who are most at risk for guinea worm are those who don't have access to clean water and are literally drinking out of puddles where you can then ingest. So the Carter Foundation, back in 1986, there are about 3.5 million cases of guinea worm, mostly in sub-Saharan Africa. As of today, there are about 52 cases in 2019 of guinea worm. And the way that happened, there's no treatment, there's no vaccine. You know, the way that happened was through very good public health interventions. It was health education on prevention, provided not by these outside organizations that would come into these villages, but by champions within the village. And they then produced almost like a straw-like, it was like a metal straw with mesh on it, so that particularly children, adults who needed to drink from water could then use that straw, and it would strain out and they wouldn't ingest the guinea worm nymph. That may seem like a weird climate change success story, but as we start to see access to clean water become limited with these extreme conditions around drought, we are potentially going to push populations to drink water that they have never had to consider before, like puddles that could contain awful parasites. And so, again, to me, that's an incredible success story about a disease that, again, no treatment, no vaccine, no medical intervention could do anything except for the will of a community and really smart thinking of empowerment.
That's just to add to that. That's a great story, and I love also that that's like the human service that Jimmy Carter is less known for than his other human services. But anyway, the one thing, and this is sort of a silver lining kind of thing, but the the best way I can think of that impacts of climate change can create a circumstance where you have a public health success story. And again, this is very much a silver lining, not a, wow, it's a good thing that happened, is that when you have instances of disaster causing migration, occasionally what an unexpected benefit of that is if you have migration in either high enough numbers or toward a central location, you can actually wind up getting people who previously did not have access to support programs now may have access. And so I'm in particular thinking of sometimes when you have flooding in parts of India, for example, you can have even temporary migration into denser population areas where people may now have access to vaccine programs that they didn't have access to before. And so again, it's definitely well, I guess there's a good thing that came out of that terrible thing kind of look, but it can create opportunities for public health intervention.
And I would echo that. One of the key things that's happened in the sustainable development field in the last several years is the development and the ratification of the UN Sustainable Development Goals in 2015. And much of that was in response to the pressures of climate change. And what that has done has given the world a structure by which it can plan in an interconnected way. So if you look at the 17 goals, there are goals that relate to community health, economic health, and environmental health. And so that dialogue has arisen from that crisis and given us those frameworks. One of my favorite stories from this difficult time that we are in is an initiative, a sustainable development initiative in the Faroe Islands, which had developed a testing system for its pen-raised aquaculture initiatives. And they very quickly pivoted in the Faroes. That system was developed 10 years ago in response to an outbreak of disease among these fish. Within a month of COVID, they had pivoted that technology to provide COVID testing, unlimited COVID testing to the Faroe Islands, and have been able to control COVID-19 in the Faroes with the help of some of this testing. That's a movement, a sustainable development initiative that then was able to pivot because of the way people think and the creativity and the interdisciplinarity to say, why couldn't we pivot this testing to serve our human health? So it's one of my favorite stories coming out of COVID, if you can have a favorite story coming out of it.
All right, those are some excellent examples. I have a question from Ariana Walker. She's an environmental science student at UNE, and she was wondering if Dr. May could speak more on the time between the email she received at the time that the American public was informed of the threats of the pandemic. So the time frame between when you received your email and when the pandemic became very clear and publicized in America.
Absolutely, actually. That actually hits on a sore point for me because there were certainly Americans like myself who received that alert stroke of midnight, December 31st. And so there were Americans who were aware, but I take the point that it wasn't discussed publicly. And that was a source of great frustration for a lot of us because there were people like myself that January 1 were writing, this is a problem, this is what's going on, I think this is an issue. There were a lot of us, we have a community called Epi Twitter that it was a group of colleagues that we kept every day, several messages per day saying, hey, pay attention to this, pay attention to this, pay attention to this. And it just wasn't interesting to most American audiences. And in fact, when I do a kind of a longer version of this talk, I have a slide wherein I show a lot of dates of various things unfolding in the US against a backdrop of case numbers. And in fact, one of the slides is January 9th. I had reporters from ABC News sitting in my kitchen with me because they just really wanted an infectious disease story that day on the news. And they, so much so that they drove down to my house in York and sat down in my kitchen to do an interview. And so they said, what's new in this line of work? And I said, there's this thing that's going on. It's in China. Now there's cases in Thailand, there's cases in Taiwan, there's a case in Singapore, and this is going to be a big deal. And they said, yeah, no, but can you talk about flu though? So I was, I literally told a news reporter, and they said, we're not interested in that. Tell us about seasonal flu. And so that was really striking to me. But from a public leadership standpoint, the very first time the president addressed COVID-19 was January 24th in a tweet. And he mentioned, and this was only after we had the first cases in the US. It was about 48 hours after the first cases in the US. And so there was definitely a lag, but I think that's a multi-pronged problem, right? Because certainly leadership may or may not have been talking about it, and I think that's maybe a separate conversation to have. But there were scientists screaming, like, please, somebody pay attention to this. And it was sort of deemed that the public wouldn't be interested, therefore people weren't going to talk about it. So it was curious.
Wow, you sound like you're talking about climate change. People are screaming about it.
Eerie parallels, right?
All right. It looks like a lot of the audience is very interested in the infodemics and misinformation. Shelley Conrad commented that infodemics and misinformation impedes public health successes. And so that looks like a theme that we have in a lot of the comments.
I think, it's really interesting, the infodemic question, because it certainly relates to climate change as well. And there was an interesting phenomenon early on in our lockdown. And one of the things that I was seeing on social media a ton, was the celebration of pollution reduction, which was something to celebrate, indeed. So you saw these beautiful clear skies over LA, right? And you saw aquatic wildlife in the canals of Venice. And that was remarkable to see. Unfortunately, on social media, the actual reasons for that, the science behind that, was not well communicated. And so it was hard to learn from that moment what we could then do in the future to continue to see some of that change. So for instance, the question of Venice wasn't necessarily a return of wildlife to the canals, but the ability to see the wildlife that was already there, right? And so that's a very different dynamic in what you're asking, in what we might ask to see in the future. So I think we have this moment in terms of information around climate change to use these amazing images that we saw from around the world. I mean, satellite imagery of pollution reduction, fossil fuel emissions way down. I mean, I know I only filled up my car once in 4 months, and it was a great feeling. But how can we get the science solid behind that and the stories told in a way that inspire people to continue to reach for those goals, right? That this is not just something that was a unintended consequence of the pandemic. Let's go back to business as usual, right? This is a moment to see those images, understand the science, and really make transformative change.
And Holly, can I just build off of that? Because we have to capture that moment, because we lost it in 1996. In 1996, Atlanta hosted the Olympics. And when they hosted the Olympics, they kind of like shut down the city, except for traffic that was related to the Olympics. And some public health people got together and said, we need to understand the public health impacts in a good way of when that happens. What happens when emissions is lowered? What happens when we have better air quality? And there's a paper out that shows that emergency department visits due to asthma in kiddos dramatically reduced, particularly in the Medicaid population. Like, whoa. So translation means kiddos breathed better, period. And then not a whole lot change happened. So what I'm hoping is that now that this has been like beyond Atlanta, the big, and we've got like a generation who is so much more educated about climate change than my generation is going to grab hold, because we missed an opportunity.
And I think that's terrific, because I take your point, and I remember, now that you mention it, Holly, I remember seeing those pictures too, and they had images, they had infrared images over China as well, showing like, look at how much the just the atmospheric temperature is different just from this. And so I think that using that as an educatable moment is critical, because I feel like, and I think I had written this in the chat at one point or another, but I feel like I spend more time just correcting misinformation when I speak publicly than I do sharing information, which is something. I mean, it can get a little frustrating, in particular when you're having very public interactions, not in a setting like this, but in a much more open setting where you have people that go in and are intentionally trying to promote disinformation or provoke an inflamed response from you in order to discredit you, and it's very hard. And so I love the idea of, remember when we all saw this, here's why, and here's how we can move it forward. It's taking something everybody knows and saw and using it to teach them something that they actually have a very intuitive way to understand. They just hadn't made the connection yet.
Thank you to everyone for this really interesting, enriching, educational discussion. I want to thank all of our amazing audience members for these insightful questions and comments. I want to thank our discussion moderator, Camden Tillinghast, and all of our panelists for sharing your expertise. For the sake of time, I am now going to invite the panelists to begin their closing remarks. So panelists, if you could impart our UNE students, who are the next generation, with one inspirational message for the future, what would it be? And let's start with our first panelist, Dr. May, and then we can go to Professor Gunderman and end with Dr. Parker. Well, if people could see my video, my inspirational message for the moment would be, make sure your kid has a pencil when you're on a talk so that he doesn't come in and you have to hand him a purple marker to do his assignment with. Anyway, I think in terms of inspirational messages for the future as far as pandemics go, is that I fall back on that old adage, if we're not willing to learn from history, we're doomed to repeat it. A lot of mistakes that were made in prior pandemics or prior health disasters, we see in some countries, and unfortunately I would include this one in that, being made again. And we see other countries having learned from prior mistakes. And so the hopeful message in that is that
we are now having an enormous number of people that are learning very hard lessons that prior populations had already learned. And hopefully next time we will remember them. Experience is a good teacher, I guess, is my point.
I would say my inspirational message, be kind to yourself, be kind to each other, and vote.
And I would just reiterate that we have the freedom to think outside the systems we live in and to question those systems. And so I have great hope in the creativity and the ingenuity of the students that I meet and my colleagues. And so that gives me hope. And the desire to question will get us there. Always asking good questions. So thank you. That would be my piece.
Thanks again to all three of you for your inspiration, your expertise, your knowledge, your stories. We are just so grateful for you all taking the time to speak with us here today. And if the audience has any more questions or thoughts or things they would like to discuss with our panelists, their contact information is up on the screen. Please feel free to reach out to them. They would love to hear from you. Audience, also, before you leave here today, we ask that you please fill out the brief attendance survey that is shown on the screen and also posted in the chat. As a reminder to students, the event today addressed interprofessional competencies of values and ethics, as well as teams and teamwork, and can be applied to the UNE students' Interprofessional Honors Distinction Badge. We also ask that you please join us for our final event in this 6-part series, exploring the connections between COVID, climate change, and many other important issues. Our final event is on November 12th. It's called Pandemic Reflections, People, Planet, and Profits, and we'll address this topic from the angle of sustainability. So many thanks again to all of our amazing audience members for joining us today. Thank you to our panelists, and thank you to our wonderful partners, the UNE Planetary Health Council and the Center for Excellence in Collaborative Education. I hope we all have a wonderful day.